hold this arm now. You got rib torque going on. So basically, fine here, counterclockwise, it is not. So hands by your side. Take a deep breath and breathe out. Again, and out. Again, breathe again. Good, and hold this arm again, nice. Actually had a 16-year-old kid have rib torque and they didn't know it. So they were a patient here before, but they had to pause care because nobody could drive them. They live all the way in Delaware.
I'm familiar.
So breathing issues and then tachycardia, right? And passing out.
Oh gosh.
EKG negative, they couldn't find anything. She had rib torque. This crazy stuff that nobody looks for, you know what I mean? Imagine the thousands of dollars they just spent on the testing. That probably would have paid for their chiropractic care for like 5 years.
Yeah.
It's crazy. I mean, this is the stuff that works, that is so simple, it's not invasive, it's safe, and it makes you happy. And it gives you that confidence, Nancy, that you know what, somebody's watching over me, over my nervous system, which controls everything in my body, and I'm going to be okay. And that I'm never going to accumulate the physical, emotional, and chemical stresses that most people accumulate because they don't know. That would be like you're not showering for like a year. How horrible would that be? What about your nervous system?
Yeah.
You know, I mean, we're just so fortunate to know about this stuff because people are just, they don't know. They don't know. How are you doing with your neck extensions? You need to get back on track?
I come and go.
Okay.
Like,
All right.
I get into a groove and then something happens.
That's called being human. So just get back on track. Don't need to kick
Yep.
yourself or
Yep.
anything like that. Just be kind to yourself and say, all right, let's get back on track.
Yep.
Because you really need that because you have some changes in the spine that need to be reversed. Head forward, head back now. Tilt sideways, other side. Turn, turn, middle. Right there. So that nerve goes to the heart. Breathe in and out. Hold this again. Good. Your scan looks good. It looks really clear.
So too.
Yeah. So like how you started out. Remember that? So all the stresses. Yeah. Well, in the beginning it was numb. So and then it started to explode. So usually, yeah. And that's what. Yeah. This is all really, really stressed. So there, it comes and goes. And what you want to see is the consistency. See, you've been really consistent. Can you see? It has not gone back to that. And it's doing really well. Yeah, and then it started to get better.
Yeah, right.
So it's nice to be able to measure the difference that there really is an effect. It's not like we're hypnotizing you and it's like placebo.
Right,
It makes a difference.
Yeah.
And again, here's another thing. This is a measure of the muscles in your spine, right? But the same nerve that go to your muscles have a tributary that goes to the organs.
The organ, right.
That's even more important than this. Because, but by default though, if these are healthier, so are the organs.
Right.
And then you don't have to worry about having some pathologies down the road because you're all of a sudden, especially at our age now, people go, oh, did you hear about so-and-so? Now they have this diagnosis. And then they're like, what? I didn't even know that. I felt fine.
Right.
Like it's a sad thing to see that, but we're in good place because we know better. You know what I mean? You're making good choices that way.